Hello, this is Dr. Lewerenz at Longevity Health Institute here in Rochester Hills, Michigan. One of our offices here in southeastern Michigan. And I want to review with you just a few of our new advanced testing that we do here in Longevity Health Institute, me and my practitioners. And as we use our 6-point medical model, looking at everybody in an individualized, personalized way, often looking at you functionally, so looking at the root cause of everything always, that's our goal here, and looking at age as a disease so that we always catch you, if you will, in the spectrum of aging. And we can talk about true, and I mean true, documented, be able to follow with metrics, prevention, okay, so we can be proactive, and that's what we do here. So we solve your goals, and then we have our goals for you for prevention and wellness. But just a few little quick things I thought I'd go over with you. Some real new, some are in the last couple years. But we offer now a test here for our cancer patients that we believe in integrative medical therapies for cancer patients, whether they are low stage 0 or 1 or advanced metastatic cancers. And we believe in integrative medicine for cancer. So meaning we work with the oncologists, we integrate holistic and natural approaches, we try to mitigate any side effects from chemo or radiation or post-surgical. But after therapy is done, or when therapy is potentially being changed with cancer, we're using a test here called Biocept. This is a tissue biopsy that looks at, actually it's used by fluids, and this is done by a simple urine test, saliva test, blood test, cerebral spinal test, you name it, but we get actually a liquid sample. Actually this if you will, this simple blood test for patients, and this company Bioceps, you can look it up. And basically what this does is look at circulating tumor cells and circulating fragmented DNA from tumor cells that are in the peripheral parts of the blood away from the tumor, so that we can assess, one, is treatment been successful besides a CT or a PET scan, and follow up with your oncologist, but also if you are in that window of post-therapeutics with cancer and you wonder, hey, God forbid, but statistics show that these can come back in different areas and potentially can come back and be metastatic, okay, and even be often not a primary, is, well, that's based on a lot of immunity. So we have to look at your gut health and your adrenals and hormones and nutrients and diet, etc. But how do we know that, one, the therapy has worked besides CTs and PET scans, and how do we know that any therapy that we're doing here or that you're safe? And we use now Biocept, this liquid tissue blood sample that evaluates circulating tumor cells. So once the tumor's gone, you know, if you have these rogue peripheral cancer cells that potentially could take hold if you had a bad immune system, to then go from a cell to a cell to a cell to a cell to a tumor, and then a mass, and then have another cancer. A lot of studies show that once you've had one cancer, the statistics go up and up for a second and a third. So be aware of that. And this is a great evaluation that we can offer a patient. I had a patient just this week. We reviewed her results, and her results were negative for circulating tumor cells. She had actually breast cancer 7 years ago, but she's just really wanting to make sure that her immunity is well, and she's doing well, and she's doing all the right things. So that's one exciting thing. Along the cancer forefront and advancement in medicine, we also do this Ambry CancerNext screening test. Now, totally separate test, totally separate reasons. This is a 36 gene marker that we draw in patients, often our wellness and preventative based patients, that we're really targeting longevity and prevention. If you have any family history of cancer at all, this is a very smart test to get. It's a simple blood test. We get a result within a couple weeks, and basically this looks at 36 major statistical genes that are related to risk for cancer. Now, this does not mean you have cancer, okay, at all. And actually, statistics show that most cancers are not genetic. Okay, when you average all cancers, it only accounts for about 11% of cancers on average are statistical. That means 89% are non-genetic, meaning they're your diet, their stress, their toxins, their sleep, their hormones, their, that degradation of things that happen in life. Okay, but this is a great way to assess your genetics. This CancerNext test that's done by a laboratory company called Ambry Genetics. And the beauty of this is you get the genetics test and we get a result. And again, 89% of the time, it'll be negative. I'll tell you here, we're even seeing probably less than that. But I mean more of that, meaning most people are not genetic. But if you get a gene SNP, then we can tell you that in your lifetime, what are your cancer risks, okay? And then how can we focus in on that? I had a guy not very long ago that had a CHEK2 gene for colon cancer, 10% increased lift in a lifetime. So we got him on the right diet, no pork, no red meat, a lot of probiotics. We're gonna build his gut health really good, focus constantly in his lifetime on his digestion, besides good Cologuard cancer screenings and seeing his GI doctor to get colonoscopies. And very likely in his case, his GI doctor will make this recommendation, but very likely to be more than every 10 years. Very likely 3 to 5 years would be smart. So another thing that this is new in our practice, I personally invented this, and they put my mug on here, which is kind of funny. I don't make that call, by the way. We have, let's just say, people that make those decisions, and it's not not me. But this were my mugs on it. We do actually this IV facial, and it's really exciting because we've had great results. I actually had it personally done on myself. And basically what this is a microneedling with PRP, but we also give you vitamin C, and we give it in an IV form, and then we draw your blood, and we use what's called the vampire facelift type of procedure, where we're doing microneedling with high dose vitamin C in your plasma and in your platelets, which have your stem cells and growth factors. And so you can get this really, really good, robust effect on your skin, wrinkles and skin folds and blemishes and scarring and acne effects and rosacea and you name it, things like this. And so this IV longevity facial that we're doing with, again, PRP and vitamin C is wonderful. Very simple to do, not painful. Procedure basically is done by this. You get a high dose IV vitamin that will help your whole body, all your tissue and everything. We draw your blood, spin it in a machine, bring down the platelets, and we use those platelets that have the high dose vitamin C, the stem cells, growth factors and that, and we apply that to your skin on your face after microneedling. So really easy to do, wonderful results. We have many people coming in for it weekly, and that's something new this year. We also always offer this, and it's with most of our patients, but definitely any cardiac risk patient. Just want you to know and that's a blood test actually that's done in laboratories, including the Cleveland Clinic Heart Lab. And basically what this is we look at biomarkers. Always we can evaluate, and we consider biomarkers like these up here in your blood that tell us where you are on the spectrum of cardiovascular disease, clotting, blood thickening, and risks there, okay? Your whole body has to have good circulation from your brain circulation, not just heart. So we always worry about stroke and heart attacks, but microcirculation everywhere is important, and we evaluate these in your blood so that we know the status of where you're at with that. Another cool thing that we have been offering for years, but I just want to show you, and that's this salpingogram or a central blood pressure test. Now it's a simple test that's almost like a normal blood pressure that goes on your body, a couple electrodes and the cuff that goes around your bicep and that. But central blood pressure test gives this good evaluation here, okay, and a wave form here of what your heart and your artery and your aorta stretchiness is. So your vascular elasticity is, okay? Super important. As we age, arteries and things get stiffer, okay? Calcium gets laid down and circulation gets poorer. That gentleman that I just showed you their test actually, was already on blood pressure medicine, had really young AFib, actually in his 40s, he had atrial fibrillation, and has high blood pressure. We're evaluating him for if he actually, has a good control of his blood pressure, and he's late 40s now. Should we be evaluating him for cardiovascular disease? His cardiologist has given him the thumbs up. We're going a little bit deeper just to make sure that everything is working, whether it's natural, which are always going to be our first approach, but also integrating best medications and best use in that. You already heard me about it. I have a whole video on this, and you should go to our WAVi brain health, dementia, Alzheimer's prevention video on YouTube and then on Facebook. We do WAVi brain testing, which is a software EEG device, and we get good reports here on brain fitness and brain health. We look at actually brain voltage and reaction time and physical reaction time. We can see on your brain here where you might be having either circulatory or impairments or maybe even head injuries in that. And based on these p-values and speed of your brain, we can tell you where you are on the brain fitness spectrum of good cognitive function and what should we be doing. And we have many things to be doing to help your brain stay healthy, be healthy, and even potentially reverse. Now, on that topic, I bring this up because I'm often talking about it. Excellent book by Dr. Bredesen, The End of Alzheimer's. Great book. This is a great, smart doctor. Basically, we use and have been using, this is not a new book, by the way, it's been out for years, but we've been using Dr. Bredesen's model and protocol for brain health for years, and that is evaluating basically a 12-point model for memory and cognition and prevention. Many things can be done to keep your brain sharp and healthy, just like your heart and vasculature, but you have to take a really good look at somebody at a personalized approach like we do. Now, one last thing I'm going to hold up in front of you, because I think it happened many times this week, and I just thought, hey, I got to point this out, is always remember when we evaluate you, we're always evaluating you, and one of our 6 points in our model of our kind of health foundation is your hormones, okay? What makes hormones? In the steroidogenic pathway, okay? What makes all these hormones, okay? These are all steroid hormones. What makes testosterone and DHA and progesterone and estrogen and pregnenolone and all these things? What makes these, okay? Well, I didn't make this, by the way. What's the first hormone up here? Okay, hopefully you can see that it's not reflecting bad. Cholesterol. So in this steroidogenic pathway and the enzymes that convert all this stuff, you have to actually be really cognizant that when you lower cholesterol too much, and we are too aggressive about cholesterol reduction, and we are focused solely on, okay, using medications and using therapeutics that get your cholesterol to nothing, you will not make hormones, period. And you need hormones for anti-inflammation, for cognition, for memory recall, for mood, for sex, for energy, for cellular production and protection. So just remember that. And I'm not ignoring cholesterol. You can't have high cholesterol and ignore it, but we have to have something reasonable here. And I think I had 3 patients this week that either had some really misinformation and way too aggressive therapies on their lipids and not looking at the whole picture. So remember, cholesterol makes hormones. Just a little take home there. So hopefully this finds you informed now, and some of this stuff is hitting home and exciting for you, and you can share with others out there. And we are here always doing these tests for our patients. 3 practitioners and myself bring you the best in integrative functional medicine, personalized medicine, looking at root causes, looking at always why, not just what, and always doing the best in prevention and proactive medicine. So let's help you thrive, not just survive. and give us a call or look us up, Longevity Health Institute. This is Dr. Lewerenz. Be well.